Hello everyone, I'm Neha Kapoor, health coach at Sugarfit and diabetes expert. Today I'm here with another amazing session on insulin resistance and its relation to diabetes. Well, discussion on diabetes is incomplete without talking about insulin resistance. And in today's session, I'm going to highlight and discuss each and everything about insulin resistance and diabetes. So what is insulin resistance? It's a very likely, cause for diabetes in any person. This is so because insulin is unable to perform its function. Now, what is the function of insulin? Is to neutralize and reduce the glucose levels in your blood. To give you a brief background, insulin is secreted by the beta cells of our pancreas to control the level of glucose and sugar in the blood. The most important role of insulin in the human body is its interaction with glucose to allow the cells of the body to use glucose as a source of energy. Let's understand in much more depth. It is the resistance to the hormone called insulin at cellular level, where cells are unable to absorb glucose molecules, resulting in increased blood sugar levels, lack of energy, excessive hunger. These are the basic symptoms that you observe. Now, the role of hormone insulin is to help in controlling the amount of glucose in the blood. Now, what happens with insulin resistance? The body cells don't respond normally to the insulin, due to which glucose can't enter the cells easily. So it starts building up in the blood, which can eventually lead to type 2 diabetes. On the other side, the process to neutralize extra glucose molecules, the pancreas continues releasing the insulin, assuming that there is no insulin. But exactly what is the main cause? There is the insulin resistance, due to which these glucose molecules are not able to absorb. Over a period of time, beta cells gradually lose their ability to produce insulin and become dysfunctional. So that's how we get the diabetes and dependence on insulin. So externally we have to outsource it through the injections. You can observe some common signs of insulin resistance like extraordinary thirst or extreme hunger. One feels like urinating more frequently. The men have an increased waistline that is over 40 inches. Similarly, the women have a waistline that is over 35 inches. There is a general sensation of tingling in the hands or feet. The person has an unusual blood pressure like 130 by 80. Also, there is a high blood sugar levels. The skin usually turns dark and patchy and velvety, which is also known as acanthosis nigricans. Moreover, there is a feeling of sluggishness and tiredness. These all symptoms identifies and signifies towards the insulin resistance, and if you have one, you should really notice and share and discuss with your physician. If you observe any of these risk factors, then you should go for a checkup to rule out the condition. Having a very inactive life, having low levels of good cholesterol, and also having high levels of triglycerides. Having diabetes is a generational disease. If one of your parents or sibling has diabetes, you must go for a checkup. Obesity is also a significant risk factor for insulin resistance. Presence of fatty liver. Even if you do not consume alcohol, it can be one of the reasons. If you develop diabetes during pregnancy, which is also known as gestational diabetes, moreover, the risk factors increases for people who have had a stroke, medications for HIV, or others like steroids. Presence of high blood pressure, smoking is another risk factor. Make sure that you are taking care of and observing all these symptoms so that we can take care of it. To test insulin resistance, doctors recommend certain tests like testing the fasting plasma glucose. This test is used to measure the blood sugar level and usually performed after 8 hours of the last meal. If there is a high level, it requires a second test after a few days for confirmation. Blood sugar under the range of 100 milligram per TL is considered as normal, whereas the levels in between 100 to 125 falls under pre-diabetic category. A blood sugar level equal to or more than 126 milligram per TL is considered as diabetic. So we should always be aware of these levels. Next is the oral glucose tolerance test. This test is used to diagnose diabetes and pre-diabetes both. Before drinking a sugary drink, a person's blood sugar is determined. Then a pre-measured drink is given to the person. After 2 hours of drinking it, the test is again performed to check the glucose levels. The blood sugar level of less than 140 mg is considered as normal. In between 140 to 190 considered as pre-diabetic. A level more than 200 mg is considered as diabetic. Test which is very common is A1C, hemoglobin A1C test. This test is done to see the average glucose level for the past 2 to 3 months. A1C below 5.7 is normal, between 5.7 to 6.4 is pre-diabetic, between 6.5 and more is diabetic. Step number 1. Include a daily workout of at least 30 minutes. This workout can comprise moderate activities like brisk walking, strength training or yoga. Whatever you can do with consistency. Step number 2. Eating a healthy balanced diet. A recommended diet to reduce insulin resistance must be taken, which should include healthy fruits, colorful vegetables, lean and quality proteins and many more. Step 3. Maintaining healthy weight. Obesity is one of the main risk factors for insulin resistance. Hence, one must have a very conscious diet and healthy active lifestyle to maintain ideal body weight. Step 4. Medications. The most commonly prescribed medicine for insulin resistance treatment is metformin, which is also known as vitamin N, which can help to keep a check on the blood sugar level of a person. Step 5. Reduce visceral fat or belly fat, which is dangerous as it can cause the liver and the other organ to become fatty and inflamed. See, the presence of greater visceral fat is known to cause insulin resistance and vice versa. So we have to be very careful and we have to keep the weight under the check. Diabetes and the conditions associated with diabetes are often interlinked and highly interconnected with each other. So while insulin resistance can cause belly fat to accumulate, it could also be the other way around. To summarize, insulin resistance treatment is basically the maintenance of a proper and healthy lifestyle, making sure you are maintaining all the pillars of lifestyle: healthy eating, good active lifestyle, making sure that you are hydrating yourself well, you are sleeping well, you are keeping yourself stress-free, and that will bless you with good health. Stay tuned to Sugarfit. This is your health coach, Neha Kapoor.